Hello, I'm Nikki Massey and my project is over thorax atelectasis. A breakdown of this presentation is a quick description of atelectasis, how computed tomography contributes diagnostically to the topic, the typical protocols and procedures associated with the exam, the role contrast has, and any contraindications. The most basic description of thorax atelectasis is volume loss of the lung. This can be the entirety of the lung or segmented by the lobes, which is called lobar atelectasis. The left lung has 2, an upper and lower lobe. The right lung has 3 lobes, upper, middle, and lower. The lung is a pressurized sac. When that pressure is disrupted, it could cause volume loss. The lung not filling in the normal order of base, back, front, apex can cause this disruption. Hyperventilation or ventilators are 2 scenarios that could cause abnormal filling. Disease or infection can also affect lung pressure by filling the lungs with fluid or blockage of the bronchus. Atelectasis is generally confirmed first on an X-ray. CT is used for more detail of the chest as a whole or to help find the root of the problem. According to Carew, because of contrast superiority and 3D rendering, CT is far more superior than diagnostic X-ray. Multi-detector computed tomography, or MDCT, is a newer advancement that allows for faster acquisition. Because of the increased speed, patient motion is less of a factor, creating a final image that is more accurate. There is no specific pre-exam instructions for atelectasis itself. However, it is suggested if a patient suffers from anxiety or claustrophobia that they inform their personal care provider. He or she will make a decision about giving medications to relax the patient. Typically for positioning, the patient will lie supine with arms extended above the head. Feet first or head first is the preference of the technologist. Just remember to set the correct parameters in the computer so images are labeled properly. Try to make the patient as comfortable as possible to help avoid movement. Other patient considerations are to have the patient prone if lying on their back is uncomfortable. Arms can also be down by the side but is not preferred because of the extra dose and superimposition. Patient is centered to the isocenter of the gantry, made up of the mid-sagittal and mid-coronal plane of desired body part. Acquire localizer scans from above the shoulders to just under diaphragm. Adrenals included under some circumstances, such as history of cancer associated with that area. Scan should be on inspiration and single breath hold. Multiple breaths may cause the image to be slightly different with each gantry rotation. General parameters are listed for viewing. Of course, adjustments would be made depending on patient size, although dose modulation comes in handy for this purpose. Modulation equates to automatic exposure control, or AEC, which is done by controlling tube current. It's performed by 3 methods: patient size AEC, Z-axis AEC, and rotational AEC. According to pubs.org, the most recent MDCT software makes use of a combination of these methods. Reconstructions will be done with different slices at different window levels and widths. This is so the large differences in attenuation can be appreciated and nothing is missed. 3D rendering can and will be used for lung tissues and vessels of the thorax, although it's not used for atelectasis specifically. Contrast is often used for a CT of the thorax, but like 3D rendering, it is not used for atelectasis alone. The use of contrast will be up to the ordering physician or the protocol set by the radiologist. Finding out if the patient has had an allergy reaction in the past is crucial and a contraindication. Pre-medication or another modality are alternative options. This image is an example of atelectasis, showing an axial slice through the thorax with an entire collapse of the left lung. It is also a contrast study, as you can see many of the great vessels are highlighted. On a normal slice of the thorax, the hyperdense area on the left side would appear black, matching what is shown on the right side of the chest. This concludes my narration for thorax atelectasis. Thank you for your time.